I'm going to move over to OPSEU first. Thank you very much for the extensive brief. You make a lot of good points. I do want to get one issue that you make around children's aid societies and child treatment. And you say that we need to establish a fully public and accountable housing system for youth. I can't agree with you more. I mean, Global News did an investigation called Profiting Off Kids, which examined the many risky operators in the province that take care of our foster children. In fact, there's over 12,000 children in Ontario in care. And these for-profit agencies, their goal is to make money. And we know that care comes second. This has actually led to the death of a number of kids in care. David Roman, Cassie Finbow, Amy Owen, Courtney Scott, just to name a few. So this is important stuff. And there has also been a connection to human trafficking that was recently reported just in the fall in Hamilton and in Waterloo Region, my home riding. So these are the most vulnerable children. In fact, local FNCSs, when medically fragile and complex children come into care, there's no place to put them. And so FNCSs have actually had to create their own homes to provide some care. So JP, I just wanted to give you an opportunity to address this very serious issue. It hasn't got the attention that it needs. And the Liberals started the outsourcing of this care. It has not gone well. And I need the government to understand that this is untenable. In fact, it's unethical.
Yeah, thank you for that. I would argue that what we see happening in youth housing and the privatization is something that we see reflected across the board in public services. And I think that children are the clearest example of what happens when systems fail, when we fail to invest in publicly supported and public services for all of our Ontario citizens. When we look at the stories that are told by workers in these facilities, we hear the same thing again and again, which is that they're told that they have to strip down because funding's cut, so strip down their staffing levels, that the same people that they've been working alongside of who have left the agency due to workplace violence, burnout, low wages or artificially suppressed wages, I would call them, that they're brought back in via temp agencies. And being paid twice the rate. We just saw another study come out on that this morning in the Star in long-term care. I think that what we are looking at is the tip of an iceberg that will only get bigger and worse as time goes on. When you starve public funding and public services, when you privatize it, it has a direct impact on the health of communities, on children's ability to thrive, to rehabilitate, to participate. And then what we see is a generational divide that is exacerbated for these kids. We've taken away the possibility for them to step up before they've even had a chance to start.
Exactly.